But there, let's start from, so this is your abdomen, right? This is your skin. Let's hide the skin. Let's hide the skin. Right. So you're going to discover that this is your descending aorta. The descending aorta at the level of L4 is going to bifurcate, right, into common iliac arteries. The common iliac artery at the sacroiliac, at the pelvic brim, is going to bifurcate, as you can see here. It's not clear, but here it's going to bifurcate, right? And it's going to give us an internal iliac artery and external iliac artery. The external iliac artery is going to continue downward, right? And then okay, let me hide this skin. Right, so that we can see clearly, right? So as you can see, so this is your external iliac artery, accompanied by the external iliac vein. The external iliac artery, as you can see, behind the inguinal ligament, is going to continue as the femoral artery. That's your femoral artery, right? So the femoral artery is going to be as it enters the anterior compartment of the thigh, it's going to pass at the mid portion of the inguinal ligament, right? And then it's going to enter the femoral triangle. So we're going to have a femoral triangle over there, a femoral triangle. So the femoral triangle, what does it contain? If you have not done the femoral triangle, you have to check in one of our videos on femoral triangle, right? But it contains the femoral vein, it contains the femoral artery, it contains the femoral nerve, it also contains the deep inguinal lymph nodes. So that was the arrangement moving from lateral to medial. So this one is your femoral artery. The femoral artery within the femoral triangle is going to give the main branch that is called the profunda femoris. This one, the profunda femoris, or it's also called the deep femoral artery of the thigh. This one is going to give branches that are very important. So it's going to give branches. So it's going to give what we call a lateral circumflex femoral artery. The lateral circumflex femoral artery is going to divide into 3 branches, right? So this is your lateral. Okay, let me hide the vein. Right, good. So this is your profunda femoris artery, right? The profunda femoris artery is going to give a medial circumflex femoral artery and a lateral circumflex femoral artery. The lateral circumflex femoral artery is going to give 3 branches, this one being the ascending branch of the lateral femoral artery, this one being the transverse branch of the lateral femoral artery, and then this one being the descending branch of the lateral femoral artery. This one is the one that will communicate with the anastomosis around what? The knee joint. So if you're going to go with it down there, down there, down there, you're going to see that it's going to take part in the anastomosis of the knee joint. So that's your descending lateral femoral circumflex femoral artery. So for the medial, let us go posteriorly. Let's try to turn. So this is your medial. You can see that one. The medial circumflex femoral artery is going to also give a transverse as well as what? An ascending branch. So these arteries, they will take part in the trochanteric anastomosis. In the trochanteric anastomosis. That will be right here. So if we remove the iliofemoral ligament, you're going to discover that right there, here at this portion, you're going to have a trochanteric anastomosis. So the trochanteric anastomosis is made by the following, is made by 4 arteries. One, the ascending branch of the lateral circumflex femoris artery, the ascending branch of the medial circumflex femoral artery, as well as the descending branches of the superior gluteal artery and inferior gluteal artery. It will be right here. And then we're going to have a trochanteric, we're going to have a cruciate anastomosis that will be found at the mid portion of the lesser trochanter. It will be right here. That will form, it will form sort of like a T or a plus sign here. It's going to be made by the transverse branch of the lateral and the medial circumflex femoral artery, and then it's going to be made by the descending branch of the inferior gluteal artery and the ascending branch of the first perforating artery. Right. So that's your cruciate anastomosis. Right. So the profunda femoris artery is going to descend, as you can see right there. It's going to give 4 perforating branches. The first perforating branch, the second perforating branch, the third perforating branch, and then it's going to terminate itself being the 4th perforating branch. Right? And it is an artery that supplies 2 compartments, the posterior compartment as well as the medial compartment. Right? So that is the first branch of the femoral artery. Let's continue with the femoral artery. So this is your femoral artery. In this region, it will be in the what? The femoral triangle. And then it's going to be in the femoral triangle, it will be lateral to the vein. Lateral, and it will be lateral to the vein, right? But as you enter into the subsartorius or the adductor canal, it's going to move from the lateral going to the medial, crossing the vein anteriorly, as you can see here. And then it's going to be, so in the subsartorius canal, the artery will be medial and more superficial than the what? Than the vein, right? And then both of them, they are going to enter what we call the adductor hiatus. So this is where you find the adductor hiatus. But before it enters, it gives what we call a superior genicular branch that will take part in the anastomosis of the what? Of the knee. This is your, it will give a superior genicular branch that will take part in the anastomosis of that, of the knee, right? So let's go posterior to it and see how is it related. So it has entered the adductor hiatus. When it enters the adductor hiatus, it's going to be it's going to enter the popliteal fossa. So we have the popliteal fossa here. So in the popliteal fossa, it changes in name to become a popliteal artery. This will become a popliteal vein. So it's going to give in the popliteal fossa, the popliteal artery is going to give what you call genicular branches that will take part in the anastomosis around the knee joint, like this one. You see this one? This is your lateral superior genicular artery. This will be your medial superior genicular artery, right? And then take note of this. We have what you call a popliteus muscle here. A popliteus muscle that will originate from the lateral condyle of the femur, and then it will attach to the pectinal. It will attach to the posterior surface of the tibia above the soleal line. Very important, right? It's going to bifurcate into 2. It's going to give us this one. Let me remove the skin. Hide. So let's zoom. So this is your popliteal artery. Your popliteal artery at the lower border of the popliteus muscle is going to bifurcate. It's going to give us this one, that we call the posterior tibial artery is going to give what called the anterior tibial artery. The anterior tibial artery, let's go with the course. The anterior tibial artery is going to enter an opening within the superior portion of the interosseous membrane. So this is your fibula, this is your tibia, bound by what you call the interosseous membrane. Above the interosseous membrane, we have a devoid portion. This one, that's where the anterior tibial artery enters. So let's go with the course of the anterior tibial artery. The course of the anterior tibial artery. So this is your anterior tibial artery. As you can see, that the anterior tibial artery so the anterior tibial artery here is going to descend down, right? It's the what? Anterior to the interosseous membrane, but more specifically, it will be lying, right, at the floor of the flexor, at the floor of the extensor digitorum longus. And then it's going to give a branch that is called a recurrent anterior tibial branch that will supply the what? The knee joint, or take part in the anastomosis of the knee joint. As you can see, that is your what? Your recurrent. So it's going to descend together with the what? With the anterior tibial vein as well as the anterior tibial nerve. We're going to do the course of the anterior tibial nerve. It's going to descend down, 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 deep to the superior. Let me remove the skin. Deep to the it will enter deep to the superior flexor retinaculum, right? And then it will enter deep to the inferior flexor retinaculum, right? Very important. Let me hide this. Let me hide this, right? And then at the level, this is your ankle joint. At the level that is at the level of the malleoli, the medial and the lateral malleoli, is going to change its name to become a dorsal pedis artery. This is your dorsal pedis artery. The dorsal pedis artery is very important because at this portion we can hear, we can palpate or feel the pulsation of the what? Of the artery. So the artery will be sandwiched, sort of like it will be between two tendons. One here at the medial aspect, we're going to have the tendon of the extensor hallucis longus. At the lateral, we're going to have the tendon of the extensor digitorum longus of the first toe. And then between those two tendons, we have the pulsation. We can feel the pulsation of the dorsalis pedis artery. So the dorsalis pedis, that's your dorsalis pedis artery, right? Right. So done. Let's go to the posterior margin.
This one. This one.
Cotton.
Sugar.
This money be. I don't get a cost in my ima arteries. Cotton. The video is not too gig. Now let's go with the course of the posterior tibial artery. So the course of the posterior tibial artery, right? The posterior tibial artery is a branch of the popliteal artery at the lower border of the popliteus muscle. It's going to descend down and then just lower that, just just few centimeters below its origin, it's gonna give what called a fibular branch. So a fibular branch, this is your fibular branch. You can see that's your fibular artery. So the fibular artery will be posterior, running posterior to the fibular bone. It's gonna send arteries, or is the portion that's going to supply the lateral compartment of the leg, as well as it's going to send nutrient arteries to the fibula. The posterior tibial artery, it will be lying within or at the floor, or it will be descending at the floor of the tibialis posterior. So we have the tibialis posterior here, and then it will be descending, lying on the floor of the tibialis posterior, and then it's going to go down, right? And then it's going to pass posterior to the lateral, posterior to the medial malleolus, right, as you can see here. So that's your medial malleolus. That's your posterior tibial artery, your medial malleolus. You can see this one is your extensor retinaculum. Right? If we are to remove the the flexor retinaculum like this, we're going to appreciate the posterior tibial artery. So the posterior tibial artery, its relations is very important. Take note of this as I explain. So posterior to the medial malleolus, we're going to have, moving from anterior to posterior, we are going to have here, this will be a groove for the tibialis posterior tendon, and then we are going to have the extensor, we are going to have the flexor digitorum tendon, and then we are going to have the vena commutantis. Remember, this artery is going to be accompanied by vena commutantis, right? So we're going to have the vena commutantis, these ones, right? And now we're going to have the posterior tibial nerve, and posterior to the posterior tibial nerve, we are going to have the flexor hallucis longus, right? So that are the relations of the posterior tibial artery. Mind you that in thin people, this portion is also, you can also feel the pulsation of the posterior tibial artery between the tendons of the flexor digitorum longus as well as the flexor hallucis longus. You can feel the pulsation of the posterior tibialis artery. Then in the sole of the feet, this is the one, this artery is the one that supplies the sole of the feet. It's going to divide into medial and lateral. So as you can see, this is your medial plantar artery. This will be your lateral plantar artery. They are going to supply the sole of the feet. So yeah, guys, we managed to go through the course of the femoral nerve, from the abdominal aorta down to the foot, as well as managed to speak of its relations. So this is the end of our video. We are going to have another video for the course of the femoral nerve as well as the sciatic nerve. Thank you so much. See you next time.